Good afternoon. I think we've turned the clock after 12 o'clock. So thank you very much for having me here. And I'll start off with the same existential question as Mr. Bose and Anit said, like, why am I here? I'm an economist. I've worked for the past decade or so in the field of elementary education and to some extent in health and HIV. So when I was invited to present in this August forum, I have a few butterflies in my stomach. And since this is my first ever foray into the field of early childhood development, I decided to go to the field in order to understand what's going on. And this forum is about costing. So not going to the field and doing costing means reading a lot of very boring government documents. So which is what took me to Rajasthan about a month ago. And Mr. Bose mentioned a survey that is done every year in selected districts of India which track expenditure on education, especially elementary education. And we try to find out whether schools which are supposed to receive some money has actually received it or not. And interestingly, one of the schools in our survey is this one. As you can see, it's about 4 acres of land, pretty barren, and at the end of the line you have a school which has 2 classrooms. So we went and we were trying to disseminate the results of the survey to a group of parents, and it was a pretty nice classroom, and we said, the teacher said, well, the money didn't come for the teaching learning material. And I said, well, still you have done pretty well. The walls are whitewashed, and like you have got some material over there. And then the headmaster very sheepishly said, actually, this is the early childhood center. And the actual classroom is the next one, which, because the enrollment in that school has fallen below 30, they can use only 1 classroom, and the other classroom has been given to the early childhood development center, which we call Anganwadi. A little bit further to another village, we came across this old, pretty dilapidated building, which also serves as an early childhood center. So here, the courtyard is not that big. There are certain stimulation items and all that. But finally, what it boils down to is that both these centers are actually feeding centers. So food is the main source of activity. Now, if you look at it from I'm sorry, there's something going wrong. Okay. So if you look at it from a cycle, investment cycle, what we have here are infrastructure, human resources. The lady in the pink is an Anganwadi worker. Then there's some activity going on, some services being delivered. But finally, what we want to get at is the top right-hand corner, which is a school. So all these children should be well fed, should have early childhood education, and go to the school. Somewhere things are going a bit wrong. And if you look at the life cycle investment, I think Mr. Bose mentioned the life cycle hypothesis, that if we look at what are the stages of the life cycle and we look at where the early childhood fits in, it's actually the first 6 years, but the impact continues towards the rest of the life. And here, I think one of the important critical questions we have to answer is how are nutrition, health, ECE, education, and social protection. All of these come together in a whole big framework. And not unsurprisingly, investment in young children overlaps across generations, multiple beneficiaries, mothers, children with severe malnutrition, delivery modes, outputs, etc. And the challenges of mapping objectives to costs, cost to resources, and resources to outcome. These are not easy challenges. And economically, when we look at any joint product, any service that delivers a joint product, costing becomes very, very difficult. So we are at a moment in history in India where the ICDS, our big ECE scheme, is also undergoing a lot of reform. And if we look at the 4 big key components, they are supplementary nutrition, preschool, care and nutrition counseling, and health services. And if you look at the top, just the top bar, if you look at unit costs and what unit costs are actually prescribed, it's mothers at about $35 per mother per year. Normal child is 30, and child which is severely malnourished is about 45. That's dollars per year. Per child malnourished is 45. So we have a sense of what the government or the official unit costs are. But, and there are also certain fixed costs of creating infrastructure and also payment to services. So what has been happening in the budget? Where is the money coming from? The money comes from the allocation made to the Ministry of Women and Child Development. And as you can see, it's about $3 billion. If you have 6,000 crores, it's about 1 billion. So do the maths, we come to about $3 billion a year, which is allocated for early childhood development by the federal government. State governments mostly spend zero on this, which is something we can discuss later. But what is more surprising is, well, not all the money is released. So in fact, it has hovered around half, and now it's increased to about 70%. Why is that? One key factor takeaway from our studies are that there are complex implementation guidelines and financial management processes. And these are people who are already overburdened, who have to fill up 11 registers and also a financial register. Now, what's been the outcome? And I don't have too much of time. If we look at just the data coming from the government, the ICDS Center for Supplementary Nutrition, this is only supplementary nutrition. In Bihar, it's about 168 or 194. I mean, it's too small to read, but yeah, it's 194. Overall, all over India, it's 68 per Anganwadi center, per ECD center. This is just feeding children. And if you look at the top 4 states, which are all in North India, where malnutrition rates are high, you can see that obviously there is a huge demand for ECD services, at least under nutrition. And what has happened over the last 2 years is also that there has been a big push, and that big push has led to, this is official data caveat, significant reduction in malnutrition rates or children accessing centers who are malnourished. But obviously these have not been done by independent studies. So big takeaway, huge demand for feeding, very little emphasis on early learning. In fact, we cannot cost the early learning part and definitely not the outcome. And by the way, all this data has been compiled by Accountability Initiative, and they spend hours and hours just tracking down where that one piece of information can come from. So data is not available at transparency issues. And finally, we cannot do an outcome analysis in terms of what is the bang for the buck that we are getting, even in the nutrition space. So I'll leave those questions, and we can come back during the discussion. Thank you.